For the second consecutive day, the daily death toll from coronavirus in the UK has risen by more than 900. Yesterday, the country recorded Europe's highest daily number of deaths yet. It came as the British Medical Association issued a stark warning that supplies of protective clothing for health workers were in some areas at dangerously low levels. The Home Secretary, Priti Patel, said she was sorry if people feel there have been failings in NHS protective kit, describing the pandemic as unprecedented. 917 people have died in hospital in a 24-hour period, but that number doesn't include people who've died from coronavirus in care homes or in the community. It brings the total number of deaths in hospital to 9,875. Here's our science editor, David Shukman.
A human cost on a scale unimaginable even a few short weeks ago. And the warning is that we're not through it yet. That more families, like that of Doreen Hunt, who was buried last week, will suddenly find themselves in the grip of COVID-19.
The risk is real. Me and my mum were actually speaking about this 3-4 weeks ago. We didn't realise how hard it was going to hit our family, obviously. And we all thought it would be someone else. But we've been hit with it. And people need to realise this is real. Listen to what you're being asked to do and put them measures in place. Stay at home.
Among the casualties, a growing number of NHS staff, dying after working on the front line, fueling demands for more personal protective equipment, PPE. We spoke to a nursing practitioner who doesn't want us to use his name.
We got a lot of PPE in the beginning, but now, because we're running out, they've changed the policy and are sending us in with COVID patients with just a surgical mask only. Before, we used to wear a gown. Now they're asking us to go inside with just an apron. We're scared. We're seeing colleagues pass away every day. We're on the front line and we don't deserve it. We don't deserve it. We need more.
And this email from Kingston Hospital talks of a national shortage of gowns, saying we anticipate reaching the end of our supply of disposable gowns by tomorrow. Reusable gowns will be issued and staff are asked to name and keep them and to wash them down. The government has said it is providing huge quantities of equipment. The Health Secretary, Matt Hancock, has suggested that staff might be wasting it. And he also questioned where the victims became infected.
The work is going on to establish whether they caught coronavirus in the line of duty whilst at work, or whether, like so many other people in the rest of their lives, it's obviously quite difficult to work that out.
But research by the British Medical Association shows more than half of doctors working in high-risk environments said they were short of face masks or had none available. Around 2/3 said they didn't have eye protection. And more than half said they were being pressured into working in a high-risk area despite not having the adequate gear to protect them.
Doctors are also human beings. They don't want to become ill. They don't want their lives to be at risk. And what is really worrying us is the numbers of healthcare workers who have tragically died. So doctors are naturally afraid. But the one thing that is important is to give them the protection. And that's something the government owes us.
So at today's government briefing, ministers and officials were repeatedly pushed on when there'd be enough personal protective equipment.
It's absolutely critical that we get PPE out to all those working at the front line so that they not only are protected but they feel safe.
Would it be possible to give a commitment to a date by when the right quantities will reach the right people? Because every day we hear from certainly NHS frontline staff that they don't have the equipment that they need.
There is a clear plan. We're working with not just suppliers but manufacturers to really bolster and boost the supply that we need for PPE, which quite frankly is unprecedented during this crisis.
This question is bound to keep coming up as long as health workers and many others feel they're not getting the support they need as the outbreak continues. David Shukman, BBC News.
Well, I'm joined now by our health correspondent, Laura Foster. Laura, the number of people dying every day is miserably high. What was the assessment at the briefing today of where we are in this crisis?
Huge numbers, and horrible to see, and especially when we know there will be more to come in the following days. But there were charts shown at this afternoon's government press conference which suggest things are changing in the UK. So the first chart shows the number of people in hospital being treated for COVID-19. It's about 20,000 cases in hospital right now, and we've identified the areas with the most cases. London, the Midlands, the North West and the North East and Yorkshire. You'll notice there was a little bit of a drop around the 9th of April. That's because the government said they didn't get data from all the hospitals. But when you look at the big picture, the government points out the line is now starting to plateau in most regions. That is promising. The next graph is the number of coronavirus-related deaths for a number of countries. You can see the UK's total is just under 10,000, so not as high as the USA or Spain, but still awful. And some people might worry we now appear to be on a similar trajectory to Italy, which we've all seen pictures of over the last few months. But the government's confident that over the next few weeks, the benefits of the UK lockdown, which started nearly 3 weeks ago, will really start to kick in. And that will mean that that straight line starts to bend. And that will mean fewer people dying from this virus.
OK, Laura, many thanks. Our correspondent Laura Foster there. More than 1,000 people have been fined for failing to stick to the rules on social distancing across England and Wales. Details were revealed at the Daily News conference by the head of the National Police Chiefs Council. The Home Secretary announced that more funding for support groups which help the victims of domestic abuse will happen. Our Home Affairs correspondent Tom Simons reports.
Day after day, the same demand of the British people. Some experts are surprised at how rigorously we've stuck to the new rules of life in lockdown. But technically, that's not allowed. And even this sort of exercise is likely to prompt questions. The police have been told to engage, explain, encourage, and if necessary, enforce. 1,084 people have been fined in 37 forces so far, but it does seem to be working.
There are some grey areas, but for the most part, I think definitely there's been a decrease in people that are out and about.
The first police officer to attend the daily briefing said this was a new world for the public, but also the police.
They have new responsibilities. They are tackling new risks. The streets are empty. Businesses are closed as we all adapt to a new way of life. But much does remain the same. Officers are still out in their communities, fighting crime, protecting victims and tackling antisocial behaviour.
Of course, enforcing this is not the only thing the police have to do. Even now, lockdown has changed everything, including crime. And today we heard that the number of offences reported to police has fallen by 21%. Compared to the same time last year. But there's now a big worry that crime has moved into our homes.
It's a prison without the luxuries of prison.
After the BBC broadcast this report about domestic violence during the lockdown, a national hotline reported a 120% increase in calls. The government spending £2 million on improving services for victims. But it's also an area police will have to prioritise, along with patrolling the parks. Tom Simons, BBC News.
Well, there's news tonight about the Prime Minister. I'm joined now by our political correspondent, Ben Wright. Ben, what have you learned?
Well, Rita, the Prime Minister continues to get better, but it's clear that his convalescence is going to take some time. Boris Johnson was very seriously ill. He was in intensive care, and I'm told is now telling friends that his life was saved by the medical team at St Thomas's Hospital. Now, Number 10 are very reluctant to talk about a time frame here in terms of when he might leave hospital or be back at his desk. But I think it's unlikely he's going to be back at work within the next fortnight or so, and colleagues and doctors are telling him he must take his time to recover properly. Now, he remains the Prime Minister, of course, but for the moment, it's the Foreign Secretary, Dominic Raab, who's in charge of the day-to-day running of the government. And of course, this is a critical moment as the government navigates its response to the coronavirus pandemic. And in the next few days, it needs to decide whether or not to extend the lockdown further. At the moment, all the indications are that that will be extended, but that decision is going to be made with Dominic Raab in charge.
OK, Ben, many thanks. Ben Wright.